We're at the IAS meeting. We're with Ihab, who is the president of IAS and the president of the Society for
AIDS in Africa.
And we really appreciate you taking the time to visit with us you just completed a press conference.
Yes.
And I know that there's challenges, and I'm hoping that you can kind of give us a little bit about what you presented at this meeting.
In this meeting, we just launched the ICASA 2017, which will take place in Côte d'Ivoire, Ivory Coast, and from 4th to 9th of December 2017. So today we have Her Excellency, the Minister of Health of Côte d'Ivoire, and His Excellency, the Minister of Health of Zimbabwe, which is the country that hosting ICASA 2015, and he handing over this ICASA from Harare, Zimbabwe, to Abidjan, Côte d'Ivoire. Yes.
So, what are some of the challenges that you face? I mean, you're over all of Africa, and it's like a
yes.
And this is where all of the massive issues facing AIDS and delivery of medicines and people who are still dying, too many every day.
Actually, challenges are many. So if we speak about HIV/AIDS, this is the worst epidemic in African continents. Maybe it is very, very concentrated in Africa rather than other regions of the world. As you just mentioned, many people died from HIV/AIDS per day, every day here in African continent. Moreover, there is many emerging diseases now hitting African continent. In addition to malaria, which is one of the highest prevalence all over the world in Africa, and also TB. So many challenges. I speak about health challenges, and our organization, our ICASA, are focusing for get rid of those challenges, or at least help countries and support countries to have a platform for negotiation, for experience exchange, and to ready to eliminate HIV/AIDS and other emerging diseases in Africa.
So when you have these meetings, you discuss the models, the way they're performed and so forth, and the way processes work, and maybe there's one country is doing better than another, and they learn from each other,
yes,
and
yes.
share ideas.
Yes, of course, yes.
Best practices.
Of course. ICASA is International Conference for AIDS and Sexually Transmitted Infections in Africa. It is like IAS conference, but we more focusing for Africa. So last ICASA 2015, we end by Harare Declaration, where we consider this is the turning point, the start point to eliminate HIV in Africa. So usually we received speakers, scientists from all over the world. We received thousands of abstracts, new abstracts, that can reshape the epidemic in Africa and the whole world. So it is an international conference in nature. It is bilingual, so we received English researchers and English-speaking researchers and Francophone or French-speaking researchers. Both we have those facilities. So it is a platform, as I mentioned to you, that we just provide a platform for exchange of those experiences. As you mentioned, the success stories, and it is also the space for voices from different NGOs, different key populations, to share, to be shared in the elimination of HIV. Without them, we will never eliminate HIV/AIDS in the whole world, not only in Africa. I speak about key populations.
I have ideals that I believe that maybe can happen, and maybe it's hard to imagine, but we do have the treatments that can end this disease.
Yeah.
And we have to have the initiative, take the initiative to deliver those to all the people that need it. How that happens, I don't know, but that would end the disease. If we had everyone that we knew was positive, getting them tested, getting them to care, and getting them to where their treatment is prevention.
Yes, yes.
So it
Actually,
seems hard to believe that we can't make that happen, make that leap from here to there.
this is very important, and I think what you just mentioned is a key point to eliminate HIV/AIDS in Africa or in the whole world. And this is also the key point for the 90-90-90 strategy of UNAIDS. Dr. Michel Sidibé, he just announced it maybe in the previous IAS meeting. And in this opening, he also focusing on 90-90-90 strategy as the key to eliminate...
huge reduction.
Yes.
Not elimination, a huge reduction.
He focusing on reduction of 75% at least by 2020, and if we received 90-90-90 by 2030, that means we are in the way of elimination. So again, this HIV/AIDS is a preventive disease. Now we have a treatment that can prevent AIDS and can turn all AIDS patients to HIV-infected persons. Now, there is many researchers to eliminate also or cure HIV itself, which will be a very promising researchers in the future. So, as you mentioned, we focusing to gather all donors and all other countries to have this opportunity to increase the coverage of the people living with the treatment, using the new guidelines of WHO for to reach this 90-90-90, and also to encourage African countries to Abuja Declaration to raise their local budgets for treatment of people living with HIV.
It seems an ambitious program, but it's got to work. It's just got to work.
I wish that we will succeed in our efforts. It is a worldwide efforts to eliminate HIV, UNAIDS, Global Fund, other agencies, PEPFAR, other agencies that try funding very massive in the treatment field. That's why we raise it from 1 million to 17 million now people living with HIV on treatment, which is a massive increase.
It's massive, and it's very impressive. So we thank you very much for being here with us and imparting those important words, and being who you are, it makes sense that you would be here.
Thank you very much.
Thank you.
My pleasure. Thank you.